Alexander from FSU's College of Medicine going to join us now to answer more of our COVID-related questions. And Dr. Alexander, we appreciate you being back this week.
Thank you. I'm so glad to be back.
Yeah, all right. Well, we always start with how things are going and a look at that. Right now, it's not good. What are you hearing, and why do you think we're seeing the numbers starting to tick back up?
Well, in talking to people across the state today, the numbers are slowly on the rise in some areas and not so slowly on the rise in other areas. As a matter of fact, in Nassau County, they've had 51 deaths recently, whereas just a few weeks ago, their hospitalizations were down to almost nothing. So we're definitely seeing some changes across our state that way. As far as why I think this is happening, I think it's multifactorial. You know, the reopenings and people congregating inside to eat dinners, go out to eat, things like that. Decreased vigilance because people are just tired, that pandemic fatigue that we've talked about before. Maybe not socially distancing as much or being around loved ones more because they just miss the interaction. Not wearing masks consistently, things like that. It all plays into it. And then add in the cooler temperatures nationwide, and people are more driven to do things inside together and be around each other more. So again, multifactorial, but definitely things we need to keep an eye on and remember to stay vigilant.
The United States not the only country dealing with a mounting case total. France announcing this week that actually today they're going back under lockdown. However, some countries like New Zealand and Taiwan, they're having much more success stopping the spread. What are they doing differently?
The biggest thing that they did was they identified cases early and contact traced early. So that identification and tracing project is very, very important. And then in addition to the contact tracing, it's quarantining quickly. So anybody's been, if you've been in contact with somebody who has COVID-19, they identify you and everybody you've been around, and everybody quarantines. It keeps the spread to a minimum within communities. That's the best way to do it. And both countries did that. Now, Taiwan has the added advantage of being a country where they can control who comes in and out a little bit easier because they're like the state of Florida. They're about the size of the state of Florida. So it's a little bit easier to control those factors as well. And then in addition, some strict mask wearing rules in both countries to keep people safe.
Okay, that makes sense. It's still evolving, the situation and what we're learning about it. And the CDC recently expanded its definition of who is a close contact of someone with COVID. Can you tell us more about what they changed and why they changed it?
Yes, so this is a very confusing one. We used to say that close contact was spending 15 minutes with somebody who has been tested positive for COVID-19. This new recommendation is saying that it adds up to 15 minutes within 24 hours. So if you spent 5 minutes here, 5 minutes there, across 24 hours, adding up to 15 minutes or more, that's now considered close contact. What's confusing about that is this was based on a correctional facility worker who came in contact with 6 different people who tested positive, prisoners who tested positive over the course of 24 hours. What makes that hard is which one of those prisoners was most contagious, what was the mask wearing protocol, what was the contact exactly. There are just a lot of variables that would factor into that. The bottom line, though, is if you are around somebody who has COVID-19, your risk goes up. That's the bottom line. So those close contacts, if you're within 6 feet of another person, both parties need to be wearing masks to keep each other safe, and then trying to decrease your exposures as much as you can.
We've been talking about it now. We're in flu season. You've been recommending people, to get those flu shots, at least your last couple appearances here on the Eyewitness News at 4. So we're hearing, though, that a patient does have both at the same time. Somebody's actually come down with both at the same time. What are the chances of that? And, man, how could this impact that person?
It's a great question. We were scared, we were afraid of this all along. We're now entering that twin-demic period where not only is it flu season, but it's also still COVID season. And so when you put those together, it's a recipe for some very scary things to happen, like this person who contracted both at the same time. They lived in the Bay Area, they live in the Bay Area. They're between 20 and 65 years old and they're in healthcare. That's what we know about this person. It's not surprising that if you get one illness, it decreases your immunity and therefore makes you more susceptible to another illness. In this case, it might be COVID or the flu, whichever one came first. It just is it's going to be very difficult to tweeze out, like we've said, because the symptoms are so similar. Fever, body aches, things like that. The good news is we have a vaccine to the flu, as you just mentioned, and we have treatment for the flu. So anybody who gets sick starts feeling those symptoms, as long as they reach out for treatment right away, or at least get evaluated, get tested for the flu, get tested for COVID, then if they do test positive for the flu, they can initiate treatment and get over that more quickly. COVID's more difficult, as we know, because there is no treatment and there is no vaccine as of yet. So the scariest part of this is with the cooler temperatures that we're all feeling and experiencing and loving right now, it drives people inwards, inside, more close quarters, more close contact, and makes you more susceptible to both.
Gosh, I really cannot imagine what it would be like to have both COVID-19 and the flu. And we are going to talk a little more about the importance of getting the flu vaccine coming up a little bit later in the newscast. Before we let you go, Dr. Alexander, is there anything else that you'd like to add today?
It is Halloween weekend, as we've all been talking about, and I just heard you guys in your debate about candy corn. I am a candy corn fan. I'm just going to put it out there for everybody. So, you know, if I have to be the tiebreaker, let it be known, I am a candy corn fan. But just stay safe out there tomorrow night. If you are going to go out and do things again, remember to wear your masks and practice that social distancing.
Yeah, us ladies have to stick together, Dr. Alexander.
You can't see me. I'm giving you the cold shoulder right now, Dr. Alexander, and we love you. I just can't believe you're, signing on the candy corn. Okay, it's all right.
I had to do it. I had to do it.
Your taste buds like what they like, right? Okay. Thank you again.
That's right.
So much for being here. Hopefully, plenty of candy corn in your future this Halloween weekend. And
yes,
we'll see you back here a week from today.
All right, and of course our viewers can rewatch this interview and all of our previous ones with Dr. Alexander online at WCTV.tv. We'll be right back.